Hi there, my name is Sascha Edelstein. I'm a gynecologist and fertility specialist based at Thrive Fertility in Melbourne's north at the Northern Private Hospital that's in Epping. And today I wanted to talk to you about pre-implantation genetic testing, or PGT. So it's certainly a question that comes to us in our consults from time to time, and in fact, increasingly. There are various different types of genetic testing that we can do. Essentially, if a couple is going through IVF process, and at the end of that IVF process where we've had a stimulation, egg collection, fertilization, and embryos progressing through to the blastocyst stage, at that point, it is possible to take cells from the external aspect of the embryo, the trophectoderm, which would become the placenta, and send that away for genetic testing. So that gives us an opportunity to evaluate the embryo more than just from morphological assessment. Taking cells from the embryo and sending for genetic testing can be done for various different reasons, but the key tests are something called PGT-A for aneuploidy, PGT-M, which is for a monogenic condition, and PGT-SR, which is for structural rearrangements. So if I were to break those down, the A for aneuploidy is an abnormal combination, numeric combination of chromosomes. And this is something that is unfortunately occurring with increasing frequency in reproductively older women. So, in fact, one of the leading causes of a failed embryo transfer or a miscarriage would be if there's an abnormal combination, numeric combination of chromosomes. And so certainly in reproductively older women, and in this case we're talking about beyond the age of 37, if they have suitable embryos to biopsy, one can biopsy those embryos and then determine whether they have the correct or the normal numeric combination, which is called euploid, or an abnormal combination of chromosomes called aneuploid, and in that way select the normal embryos to transfer and deselect those that are abnormal. The key important factor to understand is that this is not changing the embryos or the code of embryos that are available. So if, for argument's sake, a woman has, or a couple have 3 embryos that are suitable for testing, and it turns out that 1 is normal and 2 are abnormal, the testing has not changed those 3 embryos. Rather, it's helped us to prioritize or select the euploid normal embryo and to deselect the abnormal embryos and not use them. Another important factor to understand is that transferring a euploid normal embryo does increase the chances of achieving live birth, but does not guarantee that. So there are other factors within the embryo and the endometrium that are going to influence implantation. So doing this intervention may rationalize embryos transferred and therefore reduce time to live birth, but won't actually change the cumulative live birth from those 3 embryos. Anyway, that's the PGT-A component. The PGT-M is if there's a specific genetic condition in the couple or in the family that needs to be evaluated and tested for because there's a concern that it can have a significant impact on the health of the unborn child. And that may be detected from family history or from screening tests that are now widely available. Conditions that you might have heard of would be something like cystic fibrosis, spinal muscular atrophy, Fragile X. These are ones that we're screening for, but actually there are a host of conditions that if the child is born with it, could be significantly impacted and would be something that we can test for. And the SR is actually a structural break in the chromosome, and it is one of the causes of a recurrent miscarriage, and something that your doctor may have detected when testing and doing what's called your karyotype and finding that there's an abnormality in the karyotype. Frequently, individuals who have a structural break in their own karyotype are not manifesting this in any way that they would be aware of until they're trying to achieve a pregnancy and experience miscarriage. PGT is an advanced technology. It's not necessarily indicated for all patients. And I think that if it's used in a select and appropriate way, can improve outcomes. But certainly it needs to also be done with a rational consideration for all of the reasons before going ahead. Obviously, PGT requires the couple would go through the IVF process in order to generate the embryos to be tested. So in and of itself, it's an additional component of the IVF process. Anyway, these are advanced techniques that we can discuss. If you are wanting to have further consult, I'm happy to discuss it with you. Thank you.